General examination of the gastrointestinal system. With any patient interaction, the hands should be thoroughly washed and dried before coming into contact with the patient's environment to prevent cross-infection. As you approach the patient, perform a general examination of the patient's surroundings and condition from the end of the bed, noting if they look distressed, pale, or jaundiced, for example. Introduce yourself and confirm the patient's name and date of birth by checking their wristband. Explain what you are going to do and obtain a verbal consent for the examination. Ensure that the patient is comfortable and maintain dignity by closing the curtains or door. Inspect the patient's hands, checking the nails for signs such as koilonychia or leukonychia. Check the palms for palmar erythema and feel the temperature and quality of the skin, noting any coldness or clamminess. Check for finger clubbing by asking the patient to put the nails of 2 fingers together as shown. The presence of a gap at the cuticle is a normal finding. Check for a liver flap as seen in liver failure by asking the patient to outstretch the arms and cock back the wrists. You may see a bilateral coarse flapping tremor. Observe the patient's pulse by placing the fingers of one hand over the radial artery on the lateral aspect of the wrist. You should count for 30 seconds and double to give a pulse rate in beats per minute. Inspect the face, looking for anemia and jaundice in the eyes, as well as xanthelasma and arcus. Check inside the mouth for signs such as ulceration and furring of the tongue, and also note the quality of the dentition. Ask the patient to sit forward so that you can perform a brief but thorough examination of the lymph nodes in the neck. Check under the chin, down the anterior and posterior neck, and in the supraclavicular area. Inspect the back for signs of sacral edema, which will appear as compressible swelling over the lower back. Ask the patient to lie back and reposition the bed so that they are fully supine. Their arms should be placed by their side. Expose the abdomen from the level of the nipples to the level of the anterior superior iliac crests, just above the pubic symphysis. Inspect the abdomen for visible scars, swellings, or deformities, such as caput medusae. Check that your hands are comfortably warm for the patient and ask if they are in any pain. Palpate the abdomen, superficially at first, starting in one corner at a site away from any pain. Progress in a logical order around the abdomen, making sure to cover all areas. Begin again, this time palpating more deeply. Note any obvious swellings or masses, and again observe the patient's face for sites which are painful. Abdominal guarding may be present over painful areas, and you may also feel a generalized rigidity in the case of bowel perforation. Check for enlargement of the liver by asking the patient to take deep regular breaths, and using a scooping action, attempt to feel the lower liver edge. Begin in the right iliac fossa and move upwards towards the ribs. Perform the same maneuver to check for an enlarged spleen, this time working diagonally up towards the left upper quadrant. In both cases, note any painful areas. Signs of an enlarged spleen can be accentuated by asking the patient to roll onto their right-hand side. Perform the same test and note if any enlargement has become more obvious. Ballot each kidney, noting any tenderness and enlargement. In normal patients, nothing will be felt. Percuss the abdomen to find the location of the liver edge. Begin in the right iliac fossa and work upwards towards the site of first dullness, which marks the presence of the organ underneath. Verify by working downwards from the 5th intercostal space. Perform the same test for the spleen, again noting the point at which the percussive note becomes dull. Check for ascites, which will be suspected from a visually obvious abdominal distension. Percuss from the umbilicus away from you towards the patient's left side. Listen for a change in percussive note suggestive of a fluid level. Hold your hand in the same position and ask the patient to roll towards you. Pause for 10 seconds to allow the fluid to drain, and in the presence of ascites, the percussive note should now have changed. Percussing back towards the umbilicus should reveal a new fluid level. This is termed shifting dullness. Complete the examination of the abdomen by auscultating for bowel sounds with your stethoscope. Listen until you hear the sounds of intestinal activity. Note any increase in pitch of bowel sounds, and listen for at least 2 minutes before defining absent bowel sounds. At this point, it is prudent to perform an examination of the groin for hernias, and a PR examination may also be necessary. Recover the abdomen and expose the patient's legs. Note the temperature and quality of the skin, inspecting the underside of each leg, and also note any swelling suggestive of edema. Recover the patient and reposition them so that they are comfortable. Spend some time explaining your findings to the patient and thank them for their time. Arrange any further tests that may be necessary, and document the examination in the notes. Once you have completed the entire examination, wash and dry your hands thoroughly before moving on to the next patient environment.